يسعدني أن لكم هذه الأفلام التعليمية التي تتناول الجانب العملي لمادة التشريح. فلنشاهد الآن هذا الشريط على أمل أن يحقق الفائدة المرجوة منه مع تمنياتي لكم بالتوفيق. يقول الله تعالى: وقل اعملوا فسيرى الله عملكم ورسوله والمؤمنون. صدق الله العظيم.
Notice that the pronatal teres lies edge to edge with the upper border of the flexor digitorum superficialis. Notice also that the flexor digitorum superficialis arises by a humero-ulnar head and a radial head. The radial head arises from the front of the radius, edge to edge with a supinator muscle. This radial head separates the supinator from the flexor pollicis longus. This is the supinator as it lies in the cubital fossa. This is the flexor pollicis longus muscle. It arises from the front of the radius and the interosseous membrane and is partly covered by the flexor digitorum superficialis. Its tendon passes deep through the flexor retinaculum to enter the thumb. In the hand, this tendon lies just medial to the thenar muscles. It's inserted into the base of the terminal phalanx. This is the flexor digitorum profundus muscle. It arises from the front and medial surface of the ulna and the interosseous membrane. It is covered by the flexor digitorum superficialis and the flexor carpi ulnaris. The ulnar nerve and artery lie between it and the flexor carpi ulnaris. The four tendons of the muscle pass in the carpal tunnel deep to the flexor retinaculum and spread to the medial forefingers, accompanied by the tendons of the flexor digitorum superficialis. Each of these tendons gives origin in the palm to one lumbrical muscle. These are the lumbrical muscles. The first the second, the third, and the fourth. The tendon of the flexor digitorum profundus perforates the tendon of the flexor digitorum superficialis and continues to get insertion into the base of the terminal phalanx. This is the ulnar nerve. It's accompanied by the ulnar artery in its lower two-thirds. But the artery and the nerve are separated in the upper third, where the ulnar artery has an oblique course. All through its course in the forearm, the nerve lies between the flexor carpi ulnaris and the flexor digitorum profundus muscles. It supplies the flexor carpi ulnaris and the medial half of the flexor digitorum profundus. Lower down, about 5 centimeters above the wrist, the ulnar nerve gives off its dorsal cutaneous branch, which goes to the back of the hand and supplies the little finger as well as the ulnar half of the ring finger. It also has a palmar cutaneous branch which arises about the middle of the forearm and crosses superficial to the flexor retinaculum to supply the skin of the medial third of the palm. This nerve is very slender and is easily lost during the dissection. Superficial to the medial part of the flexor retinaculum, the ulnar artery is lateral to the nerve, just lateral to the bisiform bone. The ulnar nerve then divides into superficial and deep divisions. This is the superficial division of the ulnar nerve, which gives off palmar digital nerves to supply the skin over the little finger and the ulnar side of the ring finger. This is the deep division of the ulnar nerve, which pierces the hypothenar muscles and supplies them and continues deeply to supply all the interosseous muscles, medial two lumbricals, and adductor pollicis muscle. This is the superficial division of the ulnar artery. It forms the main part of the superficial palmar arch. This arch lies immediately deep to the palmar aponeurosis and gives off the common palmar digital branches. Each artery divides into two palmar digital arteries which pass to the adjacent sides of two adjacent fingers. The superficial palmar arch is completed by a branch from the radial artery. This is the deep branch of the ulnar artery. It dips among the hypothenar muscles to join the deep palmar arch, which is formed mainly by the radial artery. This is the flexor retinaculum. It forms the anterior wall of the carpal tunnel. The carpal tunnel transmits the long tendons of the flexor digitorum superficialis, the long tendons of the flexor digitorum profundus, the tendon of the flexor pollicis longus, in addition to the median nerve. This is the adductor pollicis muscle. It lies anterior to the first dorsal interosseous muscle. This is the adductor pollicis muscle. It lies anterior to the first dorsal interosseous muscle and is supplied by the ulnar nerve. This is the palmar interosseous muscle of the index finger, and this is the second dorsal interosseous muscle seen from in front. The palmar interossei adduct, while the dorsal interossei abduct the fingers from the midline of the middle finger. Here lies the thenar space and the mid-palmar space, which are two facial spaces of the hand lying deep to the long flexor tendons. The thenar space lies lateral to the mid-palmar space and is separated from it by a facial septum passing to the third metacarpal bone. These two spaces are of surgical importance. This is the radial artery. It arises opposite the neck of the radius, together with the ulnar artery, from the end of the brachial artery. The radial artery is covered all the way through its course in the forearm by one muscle, which is the brachioradialis. It's accompanied by the superficial radial nerve, which is the continuation of the radial nerve after giving its posterior interosseous nerve in the cubital fossa. The radial artery crosses superficial to the insertion of the pronator teres, the radial head of the flexor digitorum superficialis, and the flexor pollicis longus muscles. Lower down, it lies in front of the lower end of the radius, where its pulsations can be felt. It curves on the lateral side of the wrist joint to lie in the anatomical snuff box. This is the radial artery crossing the floor of the anatomical snuff box. It is itself crossed by the tendons of the abductor pollicis longus, extensor pollicis brevis, and extensor pollicis longus. These tendons form the boundaries of the anatomical snuff box. It's also crossed by the termination of the superficial radial nerve and the beginning of the cephalic vein. Observe that the artery enters the first interosseous space between the two heads of the first dorsal interosseous muscle. In the palm, it gives off the pranceps pollicis artery to the thumb and the radialis indicis artery to the radial side of the index finger. It pierces the adductor pollicis to become the deep palmar arch. This is the deep palmar arch. It's formed mainly by the radial artery. It's seen piercing the adductor pollicis muscle and runs medially on the surface of the metacarpal bones. This is the adductor pollicis muscle. This is the deep branch of the ulnar nerve, seen running together with the deep palmar arch. Its termination reaches the adductor pollicis muscle. This is the beginning of the ulnar artery from the brachial artery. It runs medially deep to the superficial flexor muscles which arise from the common flexor origin. It runs deep to the deep head of the pronator teres which separates it from the median nerve. It gives off the ulnar recurrent artery and the common interosseous artery which divides into anterior and posterior interosseous branches. The ulnar artery runs superficial to the flexor digitorum profundus and accompanies the ulnar nerve in the distal two-thirds of the forearm. This is the radial nerve. It gives off its posterior interosseous branch opposite the lateral epicondyle. This is the supinator muscle seen pierced by the posterior interosseous nerve. Note that the supinator and extensor carpi radialis brevis muscles are supplied by the posterior interosseous nerve before it pierces the supinator. These are the extensor muscles of the forearm. They are arranged into a superficial and a deep group. The superficial group, in general, arises from the common extensor origin from the front of the lateral epicondyle. They begin laterally by the brachioradialis muscle, which arises from the upper two-thirds of the lateral supracondylar ridge of the humerus. This muscle lies lateral to the brachialis muscle with the radial nerve in between. It forms the lateral boundary of the cubital fossa and covers both the radial nerve and radial artery in the forearm. It is inserted into the lateral aspect of the lower end of the radius. The brachioradialis overlaps the two radial extensors of the wrist. The extensor carpi radialis longus and extensor carpi radialis brevis. The extensor carpi radialis longus arises from the lower third of the lateral supracondylar ridge, while the extensor carpi radialis brevis arises lower down from the common extensor origin from the lateral epicondyle. The longus muscle is superficial to the brevis, and both muscles are crossed below by the abductor pollicis longus and extensor pollicis brevis. The extensor carpi radialis longus is inserted into the back of the base of the second metacarpal, while the extensor carpi radialis brevis is inserted into the back of the base of the third metacarpal. The two muscles, longus and brevis, occupy the second compartment, deep the extensor retinaculum. This is the extensor digitorum muscle. It arises from the common extensor origin, and its four tendons pass to the medial four fingers. The extensor digiti minimi appears to be a part of the extensor digitorum muscle, and its tendon goes to the little finger. The little finger, therefore, has two tendons, one from the extensor digitorum, and the other is the tendon of the extensor digiti minimi. On the dorsum of the proximal phalanx of each finger, the extensor tendon expands to form the extensor expansion. This expansion is attached to the base of the middle and distal phalanges. This is the extensor carpi ulnaris muscle. It arises from the common extensor origin and extends along the ulna, to which it is attached by an aponeurosis, and it is inserted into the base of the fifth metacarpal. Notice that the posterior border of the ulna separates the extensor carpi ulnaris from the flexor carpi ulnaris. This is the anconeus muscle. It is the shortest muscle of the group. It arises from the lateral epicondyle and is inserted into the upper fourth of the back of the ulna. This is the extensor retinaculum. It extends across the back of the wrist and holds the tendons of the extensor muscles within the 6 compartments deep to it. This is the first compartment deep to the extensor retinaculum. It lies on the lateral side of the wrist and transmits the tendons of the abductor pollicis longus and extensor pollicis brevis. This is the second compartment. It transmits the tendons of the extensor carpi radialis longus and brevis. This is the third compartment. It transmits the tendon of the extensor pollicis longus only. This is the fourth compartment. It's the widest and transmits the tendons of the extensor digitorum and extensor indicis, in addition to the termination of the posterior interosseous nerve and the anterior interosseous artery after emerging on the back of the forearm. This is the fifth compartment. It transmits the tendon of the extensor digiti minimi, which is a very slender tendon. This is the sixth compartment. It transmits the tendon of the extensor carpi ulnaris. Here, the superficial group of muscles are divided and reflected to show the deeper group. This is the brachioradialis. This is the extensor carpi radialis longus. This is the extensor carpi radialis brevis. This is the extensor digitorum. This is the extensor digiti minimi. This is the extensor carpi ulnaris. Now this is the deep group of muscles. From above downwards they are the supinator, the abductor pollicis longus, the two extensors of the thumb, and the extensor indices. This is the supinator muscle. It arises from the supinator crest of the ulna and winds round the upper part of the shaft of the radius to be inserted into it. It has been seen in the cubital fossa where the posterior interosseous nerve pierces it. On the back, the nerve appears through the lower part of the muscle. It supplies all the extensor muscles of the back of the forearm except the brachioradialis and the extensor carpi radialis longus, which are supplied by the radial nerve on the lateral side of the arm, and the extensor carpi radialis brevis and supinator, which are supplied by the posterior interosseous nerve before piercing the supinator. This is the posterior interosseous artery. It appears on the back of the forearm, just medial to the nerve. Keep in mind that the artery pierces the interosseous membrane and not the supinator, so it's medial to the radius, while the nerve is lateral to it. The posterior interosseous artery is lost among the muscles and is replaced below by the termination of the anterior interosseous artery, which pierces the lower part of the interosseous membrane and runs downwards on the back of the wrist, deep to the extensor retinaculum. This is the abductor pollicis longus muscle lying edge to edge with the supinator. It arises from both the radius and ulna just below the supinator. This is the extensor pollicis brevis muscle arising from the radius. The abductor pollicis longus and extensor pollicis brevis muscles descend together and their tendons wind over the two tendons of the extensor carpi radialis longus and brevis. The abductor pollicis longus is inserted into the base of the metacarpal bone of the thumb, while the extensor pollicis brevis is inserted into the base of the proximal phalanx of the thumb. This is the extensor pollicis longus muscle. It arises from the back of the ulna, just below the abductor pollicis longus origin. Its tendon has its own compartment deep to the extensor retinaculum, where it winds around the dorsal tubercle of the radius and the thumb. It forms the medial border of the anatomical snuff box, and continues on the back of the thumb to be inserted into the base of its distal phalanx. This is the extensor indicis muscle. It arises from the back of the ulna, just below the origin of the extensor pollicis longus muscle. Its tendon runs in the fourth compartment of the extensor retinaculum, together with the tendons of the extensor digitorum. It runs to the back of the index finger to join the extensor expansion, which is common to it, and a tendon from the extensor digitorum. Note that each of the thumb, the index finger, and the little finger has two extensor tendons. The thumb has the extensor pollicis longus and extensor pollicis brevis. The index finger has the extensor indicis and the tendon from the extensor digitorum. The little finger has the extensor digiti minimi and a tendon from the extensor digitorum. All these tendons are seen clearly on the back of the hand, with the dorsal interossei filling the gaps between the metacarpal bones. There are 4 dorsal interossei. Both the palmar and the dorsal interossei put the hand in the writing position, and all are supplied by the ulnar nerve, which, if paralyzed, leads to a condition called claw hand. Paralysis of the radial nerve or its posterior interosseous branch will paralyze the extensors of the wrist, leading to wrist drop. Median nerve paralysis will lead to ape hand, where the thumb is adducted to the other fingers.
Well, this is the end of the anatomy of the upper limb. I hope that on these 2 hours, in part 1 and part 2, you had sufficient knowledge for the anatomy of the upper limb. Now we are going to describe the knee joint. This is the right knee joint, open from the front. This is the patella, and this is the ligamentum patelli, replacing the anterior part of the capsule of the joint. This is the alar fold and the infrapatellar pad of fat, which are some of the structures present inside the joint. The lower part of the quadriceps femoris replaces the upper part of the front of the capsule. It is separated from the front of the femur by a space lined by synovial membrane called the suprapatellar bursa. This bursa is continuous with the cavity of the knee joint. Within the cavity of the joint lie the two cruciate ligaments and the two menisci. This is the anterior cruciate ligament lying in front of the posterior cruciate. This is the posterior cruciate ligament. The two cruciate ligaments extend from the intercondylar area of the tibia to the intercondylar notch of the femur. This is the lateral meniscus, and this is the medial meniscus. They are connected together anteriorly by the transverse ligament. The joint is provided on each side by a strong ligament. The tibial collateral ligament on the medial side and the fibular collateral ligament on the lateral side. This is the tibial collateral ligament. It is flat and triangular and descends from the medial epicondyle to the upper part of the medial surface of the tibia. This is the lateral side of the knee joint. This is the fibular collateral ligament, which is cord-like. It extends from the lateral epicondyle of the femur to the head of the fibula. Deep to this ligament lies the tendon of the popliteus. This is the tendon of the popliteus inside the knee joint. This is the knee joint widely open to show the menisci. This is the medial meniscus. This is the lateral meniscus. This is the intercondylar area. This is the transverse ligament of the knee, extending between the anterior ends of the two menisci.